Our residency program is a small, family-sized program. The residents, they know each other, they support each other, they grow together, and they grow not only academically, but professionally and personally.
The atmosphere is very close-knit, small community hospital. Everybody's very nice, and I know it can sound a little bit cliche, but it's really true here. It's a beautiful hospital and such a gorgeous place to work.
Stamford is great. It's a wonderful place to live. It's such a cultural city. Its proximity to New York makes it very diverse. There's a lot of great restaurants, like cuisines from all over the world.
Stamford Hospital, everybody knows each other's names. That creates a very different learning environment where we're accountable to each other because we know who the other people are.
It's really the environment that Stamford Hospital and all the residency programs here kind of foster between like attendings, consultants, residents, other faculty members, and like the ancillary staff.
Another world that not many hospitals can say they're part of is the world of Plaintree. Its emphasis is on the hospital environment, including the architecture, assuring lots of natural light, lots of quiet spaces, and assuring that patients and families are really involved in their care.
One of my favorite parts of the program is how genuinely interested they are in helping our residents. They genuinely care about our scholarly activities, about our education on the floors and in the clinic, as well as becoming well-rounded individuals in general. And they make sure that each one of us is tended to and taken care of so that we can focus on our learning and on becoming very competent physicians.
They also focus on how you're doing and what your needs are, and I think the program really focuses on your ability to be well before you heal others.
One of the things I like about the Stamford Health residency program is our wellness activities. We go for group dinners. This is the time where we have opportunity to bond outside of work. As we're a really small program, this is such a nice environment, and it's also a way for us to feel very welcome.
We have a strong emphasis not only on resident well-being, but also on academic excellence as well. We have a world-renowned faculty. Our program has a strong emphasis on research, on quality improvement projects, and also on other scholarly activities as well.
The great thing about Stamford Hospital is we have such an environment where we can take the time to learn and process and think about our cases.
We're a major educational affiliate of Columbia. Columbia medical students rotate, so we have a very rich academic environment.
Teaching and didactics here is very strong. There's a lot more formal education here than there are in most other programs. There's at least something every day, and then there's also a academic half day on Tuesdays, which is 3 back-to-back lectures in the afternoon where all of your clinical duties are shelved. You basically are just responsible for learning.
When I was looking at Stamford Hospital and applying to residency programs, one of the things that was really important to me was the diversity of the patients and of kind of the pathology.
I found it very comforting to be in this residency program because we have such a diverse population among the residents, among our specialists, and especially among our patient population.
Patients do better when they trust their providers, and that's a culture that we promote here in Stamford Hospital.
Our floor experience is very strong. We work one resident with one intern. Our attendings are very knowledgeable. They're available for us as soon as we get on until we sign out. We work extremely close with them.
Going through the ICU rotation really is where you learn the most. We don't have any ICU fellows, so really the residents act as the ICU fellows. We work very closely with the ICU attendings, with the nurses who are great, the respiratory therapists, and it's a great learning environment. The ICU allows us to have a lot of hands-on with procedures.
We have developed a multi-modality, multi-year ultrasound curriculum for our house staff. This involves bedside teaching as well as simulations, models, and didactic lab sessions.
A lot of our residents have been trained in how to use point-of-care ultrasound for bedside clinical emergencies. Our ICU and intermediate care unit all have their dedicated ultrasound machines, and we also have 3 handheld butterfly devices which are at disposal for the residents.
Our internal medicine clinic is associated with Optimus Healthcare, which is a federally qualified health center that has multiple clinics throughout the Stamford and Fairfield County community. I think the clinic rotation offers a lot of opportunity for both primary care and specialty care.
If
It's just so rewarding when you develop your own patient panel. It does give you lots of experience to learn different aspects of the outpatient medicine.
Because we're a small program, the program leadership knows us as individuals and helps us create an individualized learning program.
Our program director matches like our passions and our ideas with what we want to do and assigns us an advisor to help us through that track. She knows all of us individually. She knows where we want to go with our career, what we want to do in life, and then kind of like what things we're passionate about within the field of medicine.
The graduates of residency program, they are encouraged to pursue whatever field of interest that they have. If they're interested in fellowship or if they're interested in hospitals or primary care.
Residents who have gone beyond the residency program, and they tell us that the program definitely prepared them for the future and what lies ahead.
I think the best advice for picking a program is remembering your life outside the program and in the program. You got to be somewhere where you're going to be happy and comfortable.
If you're looking for a place to grow, be supported, and grow professionally, I think Stamford would be the best place for you because the small class size provides a very individualized learning opportunity.
It truly feels like a family. We're always there for one another. We're always there to support each other.
If you're looking for a program that you would like to be nurtured, have support of your peers and faculty with great clinical exposure to the outpatient, inpatient setting, you should apply to our program.